We are back on MorningLine. Thanks for joining us. Dr. Cosby Stone's with us. He is an allergist, an expert over at Vanderbilt. Good to have him on. Talking about allergy, you know, a lot of people just think spring's allergy season, and I learned it's year-round, depending on what the heck you're allergic to. What are you allergic to right now? I mean, it's ragweed now? Is that?
Yeah, so it's ragweed. So I once looked at the data that Google keeps on when are people searching for their allergies, and as you can imagine, as you go through the year, springtime, big searches, and then in the fall, big searches. So the two big peaks that we have, you know,
it really is spring and fall.
Spring and fall, and that's also when people report the majority of asthma symptoms. You know, so spring when the tree pollen, and then in the fall when it's ragweed and the viruses start coming out.
Oh, okay. It's just funny because I will feel it. I will feel run down because of allergies, even with the meds I'm taking or whatever. And I can tell when all of a sudden the allergies are out of the system. And it seems to come when things cool off for me anyway, even though I think ragweed still gets to me. And I have so much more energy, it feels like.
Yeah, when you get a hard frost, that's when the ragweed finally goes away. Okay. You know, but right now, the things that we're going to be dealing with in the fall, and maybe we won't have, you know, fingers crossed, if we have a cool, dry fall, you tend to have less allergies. If you have a warm, wet fall, you tend to have more because the two things that you're dealing with are the weeds that are making their pollen. They like it warm and wet, and also the mold. And so when mold is growing on the fall leaves, you know, it likes it warm and wet. And so if you have a warm, wet fall, you tend to have more allergy symptoms. If you have a cool, dry fall, people tend to feel better. Okay. So but then once you have that hard frost, then it knocks everything down.
It does, and that's where I amazingly start feeling better. Right
if you have allergy symptoms through the winter, it's usually because you're allergic to something indoors and
dust mites or something like that.
Dust mites, cats, dogs. All
right. So just I guess with regard to COVID, some of the folks who may have extreme reactions to some of this, what's the best way to tell whether or not maybe what you're feeling, some of the symptoms can mirror COVID, at least early on, whether you're having allergies or whether or not you think I should test myself for COVID?
So I think that it's important to remember, like, is this a pattern for me? Is this something that happens to me every year around this time? A little bit more likely to be allergies. The second thing is itching. Itching is a feature that's not really found with COVID. Now, there are some people who will break out in hives when they have COVID, but I'm not talking about hives. I'm talking about, like, you know, itching in your nose, your eyes, your face, where you feel like you just want to scratch. You know, your eyes are turning red, they're getting watery, you know, it's dripping. Those things are not typically related to COVID. The other thing that's related to COVID that's not typically related to allergies is fever, right? You could feel run down with allergies, but you're not going to have fever. You're not going to have the malaise, you know, the achiness, you know, the stuff that tells you that you're fighting off an infection. Yeah,
whether it's COVID or something else. Would you say, in general, can you sometimes get a fever from allergies?
It would be rare.
Rare. So if you
don't really see it. Not a typical feature.
I've had allergies before at the time when I ended up. It probably started with allergies, and then it developed into a sinus infection. Then you get so usually if you have allergies and you get a fever, it means something else is going on as well.
That's right. Yeah. So if you have allergies and your allergy symptoms have been going on for a week or two, you know, oftentimes what happens is that you'll get swelling and stasis of the mucus, you know, that's supposed to be circulating through your sinuses. And so, you know, if you can imagine, you know, how do people get sinus infections? Well, it's kind of like if you're looking at a creek and there's an outpouching of water off of the creek. You know, the water's supposed to flow, but if it gets still, then it scums over, right? So that's a sinus infection, is the mucus that was supposed to be circulating through your head and then down your throat, you know, gets stuck behind some swelling from the allergies, and then it scums over with a sinus infection.
And that's, I get one of those every year. Now, I don't get them a lot. I have friends, and they're miserable. You can almost feel it. You just feel tight up here, but that can start. The swelling can be the result at the beginning of allergies, right?
That's right. Yeah, the swelling.
And then once
often
it backs
comes from the
up, then you get an infection. So then, not only do you have allergies, now you have a sinus infection, fever, and all that, and that's where you need.
And so the goal from the allergist perspective is I would like to prevent you from getting a sinus infection all the time. I would like to prevent you from having asthma exacerbations all the time. So that's why we treat the allergies, is to try to prevent sinus infections, pneumonias, allergies, or asthma exacerbations. Those are the kinds of things that we try to prevent with our allergy treatments. All
right, and so we talked about flu shots. I talked about Claritin. Others take medicines, you know, for it, other kinds. What about the nasal sprays?
Nasal sprays,
the Flonase and stuff. Is that, and I haven't used those. I don't know if I do. What are those for? Are they for reducing inflammation there? Will they help you breathe clearer? Now, I'm not talking about neosynephrine and those others that are over the counter. I mean, or that are
the decongestants.
The nasal sprays.
So the way that I think about it is that the allergy tablets, the antihistamines, those are really good at reducing inflammation. They're also very good at reducing the itch, and they also do a great job at reducing the postnasal drip. The nasal sprays, you know, where you're putting them in, the technique you want to use is to kind of put it in your nose and aim outward like this. You don't want to shoot it straight down your throat, because if you're tasting it, you're wasting it.
Okay, good point.
But the thing that you do with those nasal sprays is that you're reducing the inflammation and the swelling. So if your main symptom is swelling, you usually get more bang for your buck from the nasal sprays, the Flonase, the Nasacort, you know, the triamcinolone, the whatever, the nasal steroid. If your main symptom is postnasal drip, you usually get more benefit from the antihistamines.
Ah, so I'm wondering, I was taking...
And if you have both, you use both.
So when I got the sinus infection, it might have helped had I been at that point using a nasal spray too to keep those areas from swelling up and backing up. And I haven't used the nasal sprays. I just used the shots and the pill.
Yeah, now the people who are like, wow, that nasal spray really helped me a lot, are the people that they're just so swollen that you can hear them breathe, like they're breathing through their mouth because they can't breathe through their nose.
If it's that's really...
Yeah, so that's the people who, you know, the nasal spray is going to open them up and they're going to start feeling better.
And Nasonex works different than the neosynephrine decongestant.
That's right.
Decongestant ones, which, you know, people use...
Yeah, they work really fast.
You zap those and all of a sudden, wow, you're clear. But they're super addicting, and you don't want to use them more than 1 or 2 times.
Yeah.
Really, I'm scared
I really
to use
reserve them.
They work so well, but I'm afraid to use them.
Yeah, I really reserve those types of decongestant nasal sprays to only use them for colds. I tell people you can have it, and I want you to feel comfortable using it, but just use it for a cold, and just use it for the first 3 days.
I wouldn't.
Because the longer you use it, the more likely you are to have what's called rebound congestion, where your nose gets so used to it that you really almost can't be without it.
Yeah, it's brutal.
So that's when your nose will just be so stopped up that you can't even really like breathe.
It just shuts down. I had a friend who, for whatever reason, didn't know, pay attention, or whatever. He used it for a sustained amount of time, and the doctor said you got to come off it. And he literally could not breathe through his nose for 6 months until he got over it.
Yeah.
I mean, it was shut. Yep. Because his body was addicted to the chemical in that.
Yeah,
and
you sort of get stuck that way.
Yeah, but when you use it just once, if you need it for one thing, boy, it's like someone put a pipe cleaner up there. But that is different chemical than, I don't have to worry as much about that if I'm using Nasonex.
You don't. That's a totally different process. So the way that works, the way the decongestant works is that it makes your blood vessels constrict.
Opens things up.
And then basically there's no fluid that's going into the swollen parts of your nose. And so the swelling goes down because no fluid can go in. Yeah. But the problem is that, you know, that just constricting those blood vessels doesn't decrease the inflammation that you might have. And so then when the blood vessels dilate again, the medication wears off, then the fluid just rushes right in there, and then you get swelling that's worse than before. So that's why I just use it for colds. I just use it for colds. You can use it for 3 days and then put it away. You know, start your clock 1 day, 2 days, 3 days. Okay, put it away.
All right, we've got some calls now I want to get to. Folks are waiting, but I always have so many questions. Let's go to Andrew first. Andrew, good morning. Are you there, Andrew?
Good morning.
I'm here. Good morning.
Hey, what's your question, Andrew?
Yes, I just had a question about sort of figuring out the difference between just regular allergies or if it could be COVID.
Sure.
I just, you know, every couple of weeks you get kind of a tickle in your throat or a little congested, and then you go get tested. And it's usually negative because it was allergies, but, you know, you can never be sure. So are there actual signs or like pairs of symptoms you can watch for together or anything like that to know, okay, this might actually be COVID?
Sounds good. Yeah, we touched a bit on that, but go ahead, give me some points.
I think, you know, the main one is obviously going to be itching. You know,
itching means if you have itching, it's probably not COVID.
Yeah, it's less likely to be COVID. Yeah. But the other thing that I would say is that if you feel like you're prone to allergies and you're just like, well, you know what I need to do is I just need to help reduce the doubt in my mind that what I'm experiencing is or is not allergies, just take the antihistamines for the next couple of months. You know, like reduce the uncertainty for yourself. Right. You know, if you know that you're a fall allergy person, just go ahead and be taking your medications, because then if you have the symptoms and you're having upper respiratory congestion and you're having fever, then you're going to feel more confident. You know, no, I was taking my allergy medicines. You know, I need to go to get this checked out. Right. Reduce the uncertainty for yourself. You can take your allergy medications. You don't have to let this be an unbiased experiment. You can just go ahead and try to take the allergies out of the equation. I think that might be simpler for a lot of people.
Yeah, because what you worry about is someone has something that they think's allergies and it's not, and they're coming to work or they're going around people. I wouldn't want to be that way. Yeah. If I felt I had a problem with now, of course, you can get the home test, check it out. You can go get a COVID test. Yeah. But you'd want to have enough. You know, obviously, if you lose your taste and smell, you know, that's taste and smell. Now, I guess you could lose some smell from bad allergies if your nose is so clogged up, right?
It can happen, yeah. And I know some folks that, like, you know, their nose is just so swollen all the time that they really can't smell very well. Yeah. You know, but the difference is that if you treat them, then their sense of smell comes back. You know, and it didn't happen all of a sudden, right? You know, that's a COVID thing. You all of a sudden lose your sense of smell. That's a COVID thing.
And by the way, when they say COVID is, you know, you lose your smell and taste. I mean, you've told me before. I mean, smell has a lot to do with taste, doesn't it?
It really does.
I mean, now is it? But there's still separate way. If I, for some reason, have a really bad head cold, I can still eat a pizza, and if I can't smell a darn thing, I can taste it. Yeah. It doesn't taste as clear to me, I guess is the word, as it does when I have a clear head.
Yeah.
But I can still taste it. It's not like, oh, I can't taste anything because my nose is clogged.
Yeah.
Whereas with COVID, is there a connection there?
Yeah, so the virus is actually damaging the nerves, you know, that conduct your sense of smell.
Smell, and then does it also damage the nerves that conduct the sense of taste?
Well, it may, but the thing about damaging the nerves that conduct your sense of smell is that smell really is, you know, like 90% of taste.
Okay, I didn't realize that much.
Yeah, so you know, it's this, you know, as you smell the food, you also are tasting the food. It's like it's a combined experience. Because taste is really fairly simple. You know, it's salty, it's sweet, it's bitter, you know, stuff like that. So if you damage your sense of smell and you can't smell the hickory smoke, then all you can taste is that it's salty and fatty, and then you're kind of like, well, you know, my pizza doesn't taste as good as it did.
Right. Interesting.
You know, like, so the sense of smell really does add the flavors and the aromas and the things that we consider to be really special.
So the fact that I'm able to taste a little when I have a big head cold means my nose is still functioning to a degree.
But it's not being damaged.
It's not being damaged.
Yeah.
Interesting. All right, let's go to Drew. Drew, good morning. Hi, Drew.
Hey, Nick, how are you?
Good. What's on your mind?
I just have a quick question for the doctor. Wouldn't balloon sinuplasty help me with most of my problems?
Yeah, so it depends on what your problems are, but like a balloon, septoplasty, rhinoplasty, so that's for the people whose sinuses are so swollen shut that they're just stuck that way.
Yeah.
And so, you know, but, you know, basically the sinuses are just like bubbles inside of our skull. So there's the maxillary sinuses, there's the temporal sinuses, you know, there's sinuses that kind of are bubbles within our skull. And those bubbles all connect to each other through tiny little holes called ostia. And the ostia are the tubes by which those sinuses drain, by which the mucus gets out of your sinuses.
Okay.
So the problem is that some people, their sinuses, the ostia are either really small or they get stuck closed because of inflammation. You know, they can't get the mucus out of their sinus, and so it's always just full of
constantly having
pressure.
that problem. Huh?
Yeah, they're constantly got pressure. So it's either just pressure from mucus or it's infection, you know, that's getting stuck in the stagnant mucus, you know, that can't get out of that sinus. So when you're in that scenario, you know, your ENT may recommend that they do a septoplasty where they either put a balloon in there and they expand it.
It's kind of like what they do to clear arteries, angioplasty or something, right?
Yeah, very similar technique. So they put the balloon in there, they open it up, and they make that hole a little bit wider so that your sinuses can drain.
Is that a temporary fix? It'll eventually close again?
It may eventually close again. It doesn't always for everybody. Some people get a long-term benefit from it.
Okay.
You know, but it's something that, you know, if you've got a good ENT, it's something that you're going to want to be doing in conjunction, you know, with an allergy doctor, so that yes, we opened it up, but we're also working on making sure that it doesn't stay inflamed and close back down again. Right? You know, you want a team kind of helping you with that. You know, but our ENT colleagues at Vanderbilt, they do septoplasties. We have, you know, rhinology experts. They focus on the nose. You know, they do those for the patients who are just sort of stuck that way, where they can't drain their sinuses.
Is that considered a surgery?
Yeah, it's a surgical procedure.
Okay.
So that, you know, the more invasive version of that is that they cut a bigger hole.
I was going to say, so there's other kinds of surgery where they go in and literally cut, but that's extreme, right?
It hurts more. You know, it's more permanent.
Yeah.
You know, but it's something that if people are just sort of stuck, you know, with like their sinuses just do not drain, you know, then it's a very nice thing to do for them.
So the answer for him would be, absolutely look into it. He didn't explain exactly his condition. He sounded like his nose was a little clogged as it was right there on that call.
I'm not going to pick on him, but yeah. So
that may be some relief for him.
It may be, and it really just depends on, you know, like how bad are my sinuses to where, like, do they just not even drain? In which case you want to, like a plumber, you want to root out the drain, or you want to open it up.
Because if they're never draining, that means you're probably constantly dealing with sinus infections.
You're either constantly dealing with sinus
pressure,
sinus pressure or sinus infections. Either one are pretty miserable. It's uncomfortable the whole time. Yeah.
Can you just go in and just fill in the sinus cavities with like concrete and just not worry about it?
I think people tried that, and it turns out you would feel much worse.
It would be bad. Sinuses are there for a reason.
Yeah, because then you'd have the sensation that my sinus is full and I can never get rid of it. It will never go away.
Okay. Yeah, they probably did think of packing it with something, but there's a reason they're there, to allow drainage.
Yeah, there's a reason that they're there, and the other reason is that it makes our head more resonant, and it helps us to regulate our temperature, and it helps us to, you know, regulate the moisture in the air that we breathe. I mean,
nature knew what it was doing.
Yeah.
All right, let's take another call from Jerry. Jerry, good morning. Hi, Jerry.
Hey, Nick. What's going on?
Good. How are you, my friend?
Good morning.
Oh, doing just fine.
Good.
I was wondering, what is more important than a commercial? Is commercial override murder?
What are you talking about?
I'm talking about I was trying for months and months to get a hold of someone that will listen about a murder case that I know of.
Wait, now you can only talk about that if this murder case had to do with someone dying as a result of a severe allergy. If not, you're just going to have to wait, Jerry, and we'll get back to you. And you can mention it to the crew in the back there. But that's not what we're talking about, Jerry. Were you paying attention? We're talking about allergies. I thought Jerry was going to ask about my next question, which is a lot of folks out there don't use some of these other conventional meds from a doctor.
Yeah.
But they use neti pots. So what is your take on a neti pot?
Yeah, so I actually like those a lot. And, you know, we talked about the reasons why you would use this medication versus that medication. And the reason why you would use a neti pot or the sinus rinse bottle, you know, those things contain a saline solution that you usually either mix up at home using a packet or what have you. But the benefit that you get from those is that they wash the allergens out of your nose.
Okay, but it's just so weird. And now, again, and you need to address
It's a weird
this.
sensation.
The other thing is how important is it? I mean, can you use tap water? Do you need to use distilled? Because you've heard of very rare cases of someone using a neti pot and getting the brain-eating amoeba.
Yeah, you definitely don't want
I hate bringing that up because that freaks me out.
You definitely don't want to scoop your water out of a lake.
Right, out of a lake you don't. But tap water maybe in general. You could heat the water first and let it cool before you use it.
That's the recommendation, yes.
Yeah, heat it up. Could you microwave it?
Yeah, you could microwave it. I mean, you would want to get it to where it's, you know, boiling and then let it cool. You know, you don't want to put hot water straight into your sinuses. It's going to hurt.
Distilled water?
Distilled water is a way to save yourself a lot of time. So people, we often tell people, like, if you're going to be doing this regularly, just buy a big jug of distilled water. Okay. You know, then you you let it warm up to a temperature that's reasonable. You know,
and the whole
comfortable
idea
for
is you put it. Yeah, I've done it a couple times. It's awkward. Sometimes it's down my throat, or it's supposed to pour in one nose and it comes out the other nostril.
Yeah. So there's two different ways of doing it, right? So if you're doing the neti pot, you know, the ideal technique is that you're sort of leaning forward. You're leaning forward and you're putting it in your nose like this, and it just looks goofy. But the column of water that's coming out is going to go up into your sinuses and then come out the other side of your nose. Right. If you lean back, you're going to be waterboarding yourself because it's going to go down your throat. You know, you're going to be drowning yourself. Now, if you're doing the sinus rinse bottle, where it's more like a sports bottle and you're squeezing it, you're going to want to lean forward like this. And it's going to go up and down and come out of your nose. And that's what you want. You don't want it going through your back of your throat, because sometimes I've done that where I'm in the shower and I'll spray. Don't lean back. You got to be leaning forward.
And you know why you don't want to do that? If there's an infection in your nose, when I've done that in the past, it washes it in your throat, and then you get a sore throat. Yeah. I mean, I don't want to do that. So you want to lean your head down. I've got a little thing of saline that I'll use sometimes. So you want your head down and you just spray it. And then it's supposed to come up and around. Or it may just get up there and settle, and then I'll blow my nose later. But I don't want to taste it in the back of my throat. Yeah, and you can control how fast it's going. Like if you tip it up high, it's going to go faster. So, you know, if you're leaning forward, there's a flow where you can wash your nose without it going down your throat. Yeah. You know, and do you think it does work? I mean, it helps. Oh, it does. Yeah, it absolutely does. Our patients love it. You know, like the ones who are stuck, you know, where they're like, I'm dealing with sinus infections all the time. You know, like I can't get away from my allergen because it's my cat and I love my cat. You know, like they use it to wash the allergens out of their nose. They use it to wash, you know, they use it to wash away mild sinus infections before they really get set in, and they do benefit from it for sure. Wow. All right, we'll take a break. We'll be back. Our final segment with our guests. Maybe more of your calls right after this. Stay with us. I'm going to try that.